Hello, I'm Michael Valastro. I'm an orthopedic surgeon. I work at Orthopedic Associates of Central Texas in Round Rock and Cedar Park. I'm a general orthopedic surgeon, which means that I take care of a lot of orthopedic issues from fracture care to sports medicine and adult reconstructive surgery. Well, in sports medicine, at the Orthopedic Associates, we take care of 3 or 4 of the high schools in the area, and I get referrals from the athletic trainers at these schools. And when they have an injury, whether it be in girls soccer or boys football, we are able to handle all the sports injuries that come from the schools. And we give the schools the ability to contact the physician directly and get the child into the clinic quickly. We take appointments same day. That way we can find out what the problem is, assess the injury, and determine whether there is a need for surgery or whether the athlete is able to return to their sport. So this is a great service for the schools. It helps them determine whether they have that athlete for returning to the field or whether that athlete is going to be out for 3 or 4 weeks. Yes, a common misconception is that as a general orthopedist we don't take care of children. Well, that's a fallacy. We take care of a lot of kids. A lot of kids come in to see us from an accident at home or an injury on the soccer field. We are able to take care of 98–99% of children's fractures. There are a few fractures that require the subspecialty of a pediatric orthopedist, but if the parents bring their kids to see us, we are generally able to take care of children's fractures. And then if we're not able to take care of it, we can get them in to see the pediatric orthopedist in a expeditious fashion. Surgery is never the first choice. We have a lot of patients that come in and see us in the clinic, and I would tell you that probably only 1 or 2 out of 10 patients that come in actually sign up for surgery. There are a lot of conservative medical treatments that we can implement prior to joint replacement surgery. Again, joint replacement surgery is only offered when medical management is failed or the patient is significantly disabled or has a significant deformity that actually would justify doing the joint replacement sooner. So again, we perform joint replacement when it's necessary, but it's not always a first choice. We're very aggressive with our rehab program, and we see very good outcomes in return to sport. Candidates for joint replacement surgery are typically people who suffer from arthritis, and there's 2 types of arthritis out there. There's degenerative arthritis or osteoarthritis, and then there's rheumatoid arthritis. People who have either degenerative or rheumatoid arthritis, they develop pain, swelling in their joints. When they get to the point where the pain and swelling is not responding to medical treatment, then those individuals would be candidates for joint replacement surgery. Not all joint replacement patients are elderly. In fact, there are a number of patients that come and see me that have joints that are worn out, that need their joints replaced, and they're still in their 40s and 50s. With the baby boomer population being more active, they have worn their joints out sooner, and they get to the point where the medicines are no longer helpful. They have a significant deformity, they've lost all the cartilage in their knee or their hip, and when they get to that point, they're in need of a joint replacement. You can have a joint replacement even though you're of the younger age, especially considering we can use different types of bearing surfaces for those individuals, which will last longer. Some of the benefits are with more minimally invasive techniques, we're able to see quicker recoveries in patient outcomes. They're able to rehab faster, get their function back quicker, and return to activities sooner following these types of operations with the newest techniques. After joint replacement surgery, you can remain very active. You can participate in an active lifestyle, which includes activities such as golf, walking, hiking, riding bicycles, swimming. Some of the higher level activities such as running or jumping, we would recommend that you would avoid because they would wear your joint out faster. But the goal behind joint replacement surgery is to help people maintain their mobility, and because their mobility is the key to their health.